name is Guangzhe CHEN. If you don't know me, I'm the Senior Director for the Water Global Practice at the bank. It's really a pleasure to be with you here today. So to start with, I try to capture this work that we've done in the next 10-15 minutes because I think it's more interesting for you to hear from the panel. But to start, I have a question for all of us, which is, have you ever had to think and work differently in what you do? I guess you have, and we certainly have at the World Bank Group and across different sectors. And what I want to share with you today is some results from a global initiative, which Laura is already mentioned. It's called Water Supply, Sanitation, and Hygiene Poverty Diagnostic. And this work really pushes us to work and think differently, and we set the stage for the high-level panel discussion today. In implementing this initiative, we basically have a sort of kind of a compass that you see on the screen. And this is start with the twin goal of the World Bank Group of ending extreme poverty and boosting prosperities. And then, of course, this and then evolve into the Sustainable Development Goal, which are consistent. And this is the compass for us to think and work differently. And how did we do this? Well, this exercise started in 2015. And we launched, as Laura said, in 18 countries in 6 regions that we work globally. And these countries are quite different. They range from fragile states like Haiti, but also to middle-income countries like Indonesia. And to guide this initiative, there are 4 key questions that we ask ourselves in this work. The one is, who and where are the poorest in the country? Second, what is the level of access to and the quality of water supply, sanitation, hygiene these poor people we see vis-a-vis the people in this country that are relatively better off? Third, we're asking the question, what are the linkage between inadequate wash services and health and nutrition and the impact on the poor? And fourth, what are the binding constraints to improve the service delivery for these poor peoples? Now, we launched it as an initiative, but it's ended up as really a journey over the last 2 years. It's been a lot of work and throughout the bank and working in different sectors. And if there's one message that I really want all of us to take away from this exercise today, is that we need to think differently if the gaps in water supply and sanitation service are going to be closed, and the improvement in human development outcome will be made, which is obviously the central cause of our work. Now, when I say we, that means collectively we. It's not just about the World Bank, but also clients that we work with in many of our client countries, and all our partners as well. Let's give an example of how we begin to think and work differently. You see in the picture, in the World Bank, just like in every country and a very large organization, staff are working in different sectors. In the water GP, we're mostly water engineer or infrastructure economists like myself. So, but to answer the question that we posed, the 4 questions, we really have to look at and think it differently. And we quickly learn when we undertake this initiative that the expertise that we have within the water practice is insufficient. We need to have expertise from our colleagues that are looking at poverties, our colleagues that are looking at health and nutrition, and of course our governance specialists in our governance GPs as well. So we form small teams in each of these 18 studies in the 18 countries that we work that have expertise in all these areas that I mentioned. And this way we can bring a diverse set of perspectives to answer the question that we pose to ourselves. So the question was, is this hard to do? Yes, it was hard to do because it's not the normal way of doing things, but we did it. So, and is it worth the effort? Yes, I think you will see it from the presentation today and from the discussion. Some of you probably get some of those country level analysis already. And why? Because it forces us to really think differently in the work we do and push our staff outside of our comfort zone and challenge our peers. So what have we learned from this initiative to think and work differently? Well, to implement this work, the issue I think Professor Tur also mentioned about the issue about water quality emerged, first of all. It become more and more permanent. And we rely on existing data in some countries and we collect some data, additional data in others. In Bangladesh, for example, one of the things that we found, which is, I'll pause and ask you, what do you think of the difference between pipe water and water you get from the pond in Bangladesh? Look at the picture. Well, to our suppliers, the answer is that they're not really different in terms of contamination or E. coli. That's the reality we're facing. And also in Ethiopia, where I used to be a country director there for several years, we also found that for rural water supply, about 90% of the rural water supply in the country also contaminated with E. coli. And does this matter? Of course it does, because this is really a silent emergency that putting vulnerable section of the population at risk, because these are typically the poor section of the country. And it's also a very high risk of widespread nutritional deficiency and diarrheal disease. Across different regions, you see from the screen, from Latin America all the way to Asia, there's an estimate by UNICEF that shows that poor child are 2 to 3 times more likely to be short for their age than child in the richest category in those countries. And this is the definition of stunting. And in 11 of the 18 countries that we conducted this study, we found roughly about 30% of the children in these 18 countries are stunted. And these are coming, including from Guatemala in Latin America to Ethiopia to even Indonesia in highly also middle-income countries. And why should we worry about this? And I think Tim is going to have the authority to say much more about this data, because stunting is a really serious risk and a powerful risk factor associated with 53% of death related to infectious disease in developing countries. And when we compare with a stunt child, a well-nourished child will have much better chance to complete more years of schooling, learns better, and earns higher wages in adulthood, thereby increasing the odds that she or she will escape a life of poverty and inability to compete in the digital age that we're talking about today. The question is then, what caused this stunting? There are obviously many factors. Nutrition experts will identify 4 main factors. One is on food insecurity, which is obvious. Inadequate care and feeding practices is another factor. Inadequate access to health services. And then the 4th one, guess what? Is the household factors such as about inadequate water supply, sanitation, or hygiene. When we say inadequate, both in terms of quantity and also in terms of quality. Sadly, we also learned that many children in poor countries don't have adequate access to any of these factors that we mentioned above. And statistics ranging from 41% of children in Democratic Republic of Congo and up to 66%, as you shown on the chart, in Niger among children. So you get the picture. This is really a serious challenge that we're facing. And these are children that really have lacking access to adequate food, adequate care, health care, and wash services at the same time. So what we found is that we really need to think, going back to the point, we really need to think and work differently to address this emergency. And that's a review from this global initiative. And intervention need to be really coordinated across the WASH, health, nutrition sector to improve human development outcomes. And if this is done, we will have a much larger impact for children to help to reach their full potential in life. So let me give an example. Research from this initiative show that if our reference population are children with no access to adequate factor of nutrition, they are stunted You see that chart. How we also found that children with only access to adequate health care can still be stunned, but on average are slightly taller than the reference population. And then if you add more, for those with access to adequate water supply and sanitation, hygiene services, and nutrition services, they're much taller than average on the reference population. So we found that children who have access to both adequate wash services and health care are gaining much more than the sum of all these parts. So if you're looking at 4 different factors, so the combination is very powerful. In places like Indonesia, that we found that children with access to multiple determinants of nutrition are 13% more likely to be stunned than children with no access. And this statistic highlighted why we need to think more critically about coordinating investments across different sectors. So let me take a moment to also share 2 other messages coming from this initiative, which are equally important. And second message coming from the initiative has to do with the allocation of resources, so we'll talk about financing a bit later. We estimated, by the way, this exercise, we estimated that we will need about 4-fold increase in spending to reach the Sustainable Development Goal 2030, about this universal access of improved water access, the SDG Goal 6. 4-fold, that's a very high order for any country to think about it, both developed or developing country alike. So what option do we have to close this gap in terms of investments? One, I think, is that we found is that future investment need to be much better targeted to close the gap between in service delivery for reaching the poor. In other words, first of all, we really need to maximize the efficiency or effectiveness of the existing resources that we have before we can really expand more. Often, policy document clearly stated that they intend to ensure equal and affordable access to water supply and sanitation services in all the country that we have. I mean, that's typical policy of most governments. However, the picture we see across country, particularly in Africa region, is that access to improved water in urban area is about something like 90%. But in rural area, those access will drop down to something like 40%. And even more strikingly, in urban areas, 66% of the population have access to improved sanitation, compared with only about 2% in the rural area. So that shows the gap between urban and the rural divide in many of the developing countries that we face. We learned that vast majority of the investments in most countries that go to the urban areas, and the rural area tend to be negative. And within the urban area tend to go to the capital city as well in many of these countries. And these statistics are difficult to ignore given that over 84% of the population in some countries often live in rural areas. So that's the reality. In Ethiopia, when I used to live, we're still talking about 80% of the population live in rural area, but much of the investment is in urban. And this investment need to reach the SDG goal are significantly more than being invested today, as I mentioned earlier. So not only that more resources required, but we need to much better targeting in terms of the existing resources for the poor and for the rural populations. So this brings us to the third question about why we need to think and work differently, which is to better understand the bridge the gap between policy and implementation. Considering an example, which I think Bella can comment on it later on, we're talking about 4-fold increase of resources that's required. In Tanzania, in a span of 12 years, from 2002 to 2014, actually the water budget in Tanzania is actually increased by 4-fold, quadruple. Yet, in 2015, access to basic water services has stagnated at just about 50%. And 40% of all rural water ponds are not functional. So that's the problem we're facing in terms of the effectiveness of the investment. The question that we ask ourselves is why we're seeing this kind of phenomena. And what we found is that failure to provide water services to the poor are not solely because of bad policies. Because in fact, policy is not bad actually in all the countries that we work with. The problem is that there's significant gap between the policy and implementations on the ground. And to understand this gap between policy implementation, we need to look at the institutional arrangements, but through a much broader lens that typically used by water sector specialists, which is why we reach out to our governance colleagues. Traditionally, we focus our attention to narrowly looking at the institutional arrangement, say, of a water utility or a water company that provides services. But if we really want to think differently and work differently, we need to look much beyond that. To understand why similarly some policies are not being implemented, it becomes typical to work with our governance and look at the political economy dimension in many of the countries that we work. In working with our governance colleagues, we begin to sort of appreciate the nuance in the institutional arrangement across different countries. And why this matter? By working in multidisciplinary team, we begin to look at areas that typically fall outside of the purview of the water sector, and looking at a common approach that will allow water staff to better understand the gap between policy and implementations. We also learned that the institutional arrangement and willingness to share power and resources across department, across ministry or agencies are unique to the countries. So that's why we really need to do the country analysis and see how this institutional setup are and what are the political economy dimensions. And when you implement reform, what are the gainers and what are the losers across this agency? So we come to appreciate that, as this young man would attest, that there's no one-size-fits-all solutions in the country that we work. In thinking differently, we also need to step back and not to begin with what the best practice would say, but by first understanding the existing operating institutional environment and the problem in the service delivery. And then we should all really learn to look at implementing changes that are possible given the political context in the country that we work, and also the capacity of the agency that we work with. So moving forward, we really need to think, again, going back to the point about think and work differently if we're going to improve the service delivery to our client countries, particularly for the poor, which is we're here to serve. As a result of this work, we're seeing now new dialogues happening in the World Bank between different specialists, different practices. But we're also using this data and analysis generate this initiative to inform our dialogue with many of our client countries. For example, 2 weeks ago, I was in Nigeria, where we actually launched this country report for Nigeria. And it was opened by the Vice President. And I think you will hear more from our country director, where we actually, the report's entitled Wake Up Call. Basically, we're saying that the service improvement over the last decade is really problematic in the country of Nigeria. So we really need to, again, require us to work and think differently. Another example, I was visiting a water treatment plant in Guangzhe, in northern state of Nigeria. This is the only water treatment plant. This city have roughly about 600, 700,000 people. On the day I visited, the water treatment plant was not working. Because why? Because there's no electricity. So, and then, yes, you typically say that the water treatment plant will have a generator. Yes, there are 3 generators there, but 2 of them are not functioning. The third one has no diesel. So basically, the city has no chilly water over those few days. So that's, again, if you only work with the water, you're not going to address this problem without addressing the power supply and other factors. Another example I think Bella can talk about in Tanzania, we're leading on a discussion on how to better target new investment in rural water supply and sanitation and align this investment with nutrition programming in the work that we do. So we're really beginning to use this information and think and work differently and to better coordinate intervention across different sectors and to better target investments. And ultimately, we want to bridge the gap between the policy and implementations. So our sincere hope is to make this analysis, data, information publicly available to all our client countries, to all our shareholders and stakeholders, and then all of us can work, aspire to think and work differently if we have not already done so. So that's all I want to say, and thank you very much for your attention.